arthritis, you have to find out what that cause is to treat it. Why? Pare-pareho naman kasi sira ang joints niyan eh. Ang tanong kung bakit nasira. Is it because of a rheumatoid problem? Is it because of a bacterial or a septic problem? Is it because of psoriasis? Heck, is it because umiinom kayo ng statins? Statins are the medications you give for patients with increased cholesterol and triglycerides. So if it is statin-induced arthritis, patient comes in, masakit ang tuhod, hindi makalakad, medyo may edad na, ma'am, patingin po ng listahan ninyo ng gamot. Lo and behold, sigurado ako may statin doon. Subukan nyo kayong tanggalin yun. 1-2 weeks, babalik sa'yo pasyente, hindi ka nga nagdagdag ng gamot. Tinanggalan mo lang siya. Babalik sa'yo, Doko, okay na ako. So you have to find out first what the cause of that arthritis is. Unfortunately, osteoarthritis, also known as the degenerative joint disease, wala talagang gamot yan. Bakit? Wala pa naman kasi na-inventong gamot para sa pagtanda natin. Kung meron, sasawsaw na ako na magiging trilyonaryo ako sigurado. So nobody has yet invented that fountain of youth that will stop us from getting old. So all we can do for osteoarthritis is just to relieve them of pain. And we start off, I showed you from paracetamol to your medications like NSAIDs, to your COX-2s, to your probably physical therapies, to even braces, supports, and all the like. You can be a little aggressive. We now inject things like hyaluronic acid. Dr. Mangao and I inject your PRP or your platelet-rich plasma. Kinukuha namin ang dugo ninyo, pinoproseso namin. Kinukuha namin kung nasa nandun pinakamalapot at makapal yung platelets. Bakit? Nandun yung growth factor. Yun ang ini-inject namin. And last but not least, steroids. Ang steroids, it's the mother of all anti-inflammatories. It's so good. I have a patient coming in a wheelchair. Magang-maga, namumula yung joint niya, saksakan ko na steroids siya, lalakad yan palabas. But the problem with steroids is it's so good, it has a lot of side effects. For the intra-articular injection of steroids, yes, it does good, but the problem is that cartilage will soften up, lalambot, making it at risk to faster degeneration. That's why I don't inject it ganun kadalas. My protocol is 2 to 3 times in a year. Kasi kung hindi, mas mabilis pang masisira yung tuhod. Kaya nga lumabas yung mga hyaluronic acid, yung mga viscous solution and the platelet-rich plasma. Now, if it doesn't work for this, we now go more aggressive to what we call arthroscopy. Arthroscopy is a surgical procedure that we actually would poke holes in your knees. Sinisilip namin, we have these instruments as thick as ball pens with a camera at the end, fiber optic cable, and a huge screen. At para kami nagpe-PlayStation doon, tinitingnan namin yung itsura. Why? Literally, linilinis lang namin yung tuhod. Once you have an arthritic joint, the smoothness, that fine contour of your joint is gone. Rough na yan. Nakalapat ang isa dun sa isa. So you could just imagine kada kilos, kada galaw, mauubos at mauupod yung cartilage na yan. And when that time comes, para kayong, alam niyo yung kumakayod kayo ng nyog para sa gata. Di ba kada kayod ninyo, nakukuha yung laman ng nyog? Ganun din kasi tuhod natin, kada kilos, kada galaw natin. So you have a lot of debris in the area. Linininis namin yon. Hinuhugasan literally. And if we find areas that are really ulcerated, wala na talagang cartilage, binubutasan pa nga namin ng konti yan. We call it chondroplasty. Why? Just for bone to grow. But it's not only for pain, but para lang magkaroon ng sclerotic area doon sa buto na yon, para mas makaibsan ng konti. Why? Your cartilage is aneural avascular. What does this mean? May A sa harapan, ibig sabihin wala. It doesn't have any blood vessels. It doesn't have any pain fibers. It feeds via your synovium and your synovial fluid. Bone, on the other hand, is very, very neural. It's very, very vascular. So napakasakit po niyan. Kaya nga yung mga may arthritis, hindi makatayo, hindi makabangon. Now, kung hindi pa makaya nun, last resort, we do a total joint replacement. Ibig sabihin, pinapalitan na namin yung joint na yan. Parang ginawa kay Era. Kumbaga, rinikap lang. Parang gulong din yan na naupod, pinalitan ninyo. Hindi yung gulong, yung ibabaw lang. That's what we call total joint replacement. So if you see the entire thing, none in all of these that I've mentioned will actually treat osteoarthritis. They are just there simply to minimize pain. And one of what we've discovered nowadays is supplementation. And what do we supplement with? We supplement with collagen. Edward has mentioned collagen a while ago. Nowadays, personally, nauso kasi nung unang panahon yung glucosamine. Yun yung commercial na naglalakad ka pa atras. The thing is, trials that were done in Europe and in the US shows that it really doesn't work anymore. So I don't give it. I haven't given it for the past several years, 3 years to be exact. It doesn't work. As a matter of fact, in the UK, it's now classified as placebo. Ano yung placebo? Parang lang binigyan ng gaw-gaw na wala naman talaga epekto. That is where collagen comes in, because what we've discovered for collagen is it has its reparative component for cartilage. Kaya lang ang collagen hindi pare-pareho. May types din yan, type 1, type 2, type 3. At yung sources, iba-iba rin. May nanggagaling sa isda, sa manok, sa baka, sa tanim, sa baboy, sa baka, at iba-iba pang klaseng hayop. So hindi pare-pareho ang collagen. And what we found out is that collagen for the joints specifically has to be type 2. And that type 2 has to come from bovine. Sa baka nanggaling. Which means any other won't have the same effects. In China, in most of the other countries, we actually have collagen hydrolysis. It's called 3R Flex. This is what we use now. Why? Kung mapapansin nyo, nakasachet. Because for collagen to work, all the trials that have been done requires 10 grams of collagen. 10 gramo. There are some that came out in the market in capsule forms. Okay lang, pareho. Unfortunately, a capsule will only contain what? 500 milligrams. So imagine mo, kung gusto mo ng 10 grams, ilang kapsula yun? 20, hindi ka kaya masulak nun sa lalamunan mo sa 20 kapsula na iinumin mo. That's why the proponents use sachets, because it's in a powder form. Nang sa ganun, halo mo na sa tubig, inumin mo, and we give it before you have your breakfast. Why? Technically, it's food. As a matter of fact, it's even classified as GRAS. GRAS, hindi mo, GRAS, generally rendered as safe. Why? Pagkain nga siya eh. So the problem is if you take it with meals or after meals, it will mix with your food, hindi na-absorb ng mabuti. That's why we give it before you take it. Anything in the mucosa of your gastric area, yung tiyan ninyo, saka na-absorb yan ng mas maganda. As a matter of fact, in a trivial way, one of the researchers is Professor Adams. He's Indian, but he's based, and he's a Singaporean national. Sa kanya pa nga, ang suggestion niya, mumugin ninyo bago nyo lunokin. Sabi ko, gross mo naman, mumugin bago lunokin. But seriously, anong meron sa bibig natin? That underlying oral mucosa absorbs faster than anything else. Kaya ngayon para sa hypertension ninyo, ano ginagawa? Pinapatak sa ilalim ng dila, di ba? Yun lang yung dahilan nun. It has a very, very small micra of a size that it's actually absorbed readily in the mucosa. In this, would you believe, I get patients, I give it to them anywhere from 1 to 3 months. In the first 2 weeks alone, I decrease that pain score of at least a half, depending on how high it is. If I get a 7 or an 8, follow up niyan in 1 to 2 weeks, nasa 4 na lang yan. Kung sila nasa 2 or 3, pagbalik sa akin, wala namang pain yan. But It's not like your anti-inflammatories that pag inom mo, 15-30 minutes, magic, tanggal ang gamot. Hindi. Why? It has to build up. So the actual effect takes in what? 5 days or so. So hindi yan iinumin, tatawag sa akin kinabukasan, Dok, fake naman yung binenta mo sa akin, masakit pa rin ang tuhod ko. Abay, hindi ko naman sinabing mawawala ka agad yan. This is to build it up. And as a matter of fact, I used to just simply give it to geriatric patients. Nowadays, no, I give it to everyone with pains and joint pains if I try to find out that there is arthritis as a component. And I even give it to athletes, even if they do not complain of pain. Bakit? Sino ba una nagkakaproblema ng osteoarthritis pag tumanda na? Yung atleta. Bakit? Bata pa lang siya, bugbog sarado na yung joints niya eh. Kaya nga 30 pa lang, nagre-retire na sila. So hindi na namimili kung kanino binibigay. Kaya matanda, kaya mas bata, as long as you have pain problem, we are simply just building up so that when the time comes na nauupod na pala,